And Bill and Candace, that latest plan of action is a regional state of emergency for Richmond, Hanover, Henrico, Chesterfield, and Goochland. And as you mentioned, their main goal here is to, as you may have heard the expression, to flatten the curve. That is, slow the spread of the coronavirus, because they know it is going to spread, but they want to slow it down and save the impact on the healthcare system.
These measures are not out of fear, but they are an act of prevention and compassion and preparation.
Richmond Health Director Dr. Annie Avula describing the recent actions from Central Virginia governments in anticipation of a greater spread of the coronavirus.
We choose to stand together and to be prepared and do everything in our power to minimize the impact it will have on the residents of our region.
And as such, the governments declared a joint state of emergency Friday morning, which they say gives them more flexibility to respond when that time comes, adding the coronavirus doesn't respect boundaries.
What happens in Hanover happens in Richmond, Chesterfield, Goochland, Henrico. It really happens to us all, so that's why we come together.
They say their main goal is to slow down the spread of the virus so that it doesn't overwhelm the region's healthcare system.
So some people will still contract the illness, they will still have serious symptoms, they will need hospital care, but if we can keep that number low enough, our hospitals have a fighting chance to keep them alive.
But the biggest challenge they face right now is knowing how and where to respond due to a lack of testing.
We only have a sense of just the degree to which it's moving in our communities.
And to that end, leaders hope testing capabilities will increase statewide by next week, including a screening and testing center in Central Virginia.
We are kind of working through the logistics and hoping that we could stand something up next week.
And Dr. Avula was asked how long he thinks this will go on in Central Virginia. He says based off of other regions, he's predicting between 2 to 3 months, but adds if their ability to slow the spread of the virus is effective, then that length of time may be a little bit longer. Working for you in Richmond, Cameron Thompson, CBS 6 News.